And we are going to be asking the big question. And the big question is whether or not cell salvage should be done by an independent person working in theatre with no other roles, or should it be a role of someone else who's already present within that theatre?
Hi, everybody. My name's Elle-Marie. I'm the Blood Conservation Coordinator at North Bristol Trust, which is now part of the Bristol Group. I'm the South West Patient Blood Management Chair and a member of the UK Cell Salvage Action Group. So thank you very much to being invited for this. Hopefully we can talk through some of the pros and cons of an independent cell salvage operator versus a dual role cell salvage operator. So I believe that cell salvage should be undertaken by a trained, competent member of the pre-existing team. So my claim is that by utilising a member of the team, it reduces financial and resource waste, it provides flexibility to the service, it encourages accountability and responsibility in line with professional standards, and most importantly, it supports the availability to deliver specific patient requirements. So we've just heard from Manisha about the UK Cell Salvage Action Group 2022 findings. We asked who performed cell salvage. So in this slide, you can see that 64%, which was 59 out of the 92 trusts, an ODP or anaesthetic nurse providing the support for the anaesthetist performed cell salvage. Other roles included midwives, healthcare assistants or MCAs, transfusion practitioners, and in some cases, an additional anaesthetist provided the cell salvage support. And like Manisha said, 4% had external providers coming in for cell salvage. We then asked if the person responsible for cell salvage operating was expected to perform other roles inside or outside of the theatre during this time. As you can see on the chart here, that 20% said cell salvage operators were completely supernumerary to their roles, and 68% had other concurrent roles inside theatre, and 5% had concurrent roles outside of theatre whilst operating ICS. This shows in the majority of the respondents to the survey that cell salvage is performed by an ODP or anaesthetic nurse supporting the anaesthetist, and they do have dual roles. We also asked if there was a 24/7 service provided, and 77% of the respondents said that there were 24/7 services provided, which is excellent. So the NHS must take decisive steps to enhance sustainability and limit waste across financial and resource domains. This involves embedding sustainability into quality improvement. Inefficiencies such as using an extra cell salvage operator can be improved. Staffing an operating theatre is really expensive, so it costs about £14 per minute, which equates to about £840 an hour. So if we can utilise the pre-existing team members, you're going to reduce staffing costs and resource waste within the theatre. Key strategies to reduce operating theatre costs include cross-training staff so that teams can adapt to the needs of the patient. In this slide, I've showcased the increase in the number of cell salvage cases performed over the last 10 years at North Bristol by changing from a specific supernumerary cell salvage operator to having somebody from the rest of the team, utilising that other team member that's dual-rolled. We've not only grown, but we can now offer cell salvage to any patient that might need it, creating a safe, flexible cell salvage service. There may be times, however, when we can't use a separate somebody part of the team and a separate cell saver operator is required. This might be in major hemorrhage or if surgery is technically difficult. Again, safety is paramount and communication is essential so that appropriate team members are available for the operation. This initiative is for planned surgery and where possible in emergency surgery too. For example, we're a regional PAS service, which often has 2 or 3 cell saver machines with patients losing over 6 litres of blood. So clearly patient care is vital and therefore we have a separate cell salvage operator to that of the ODP anaesthetic nurse in theatre. Caroline, I'm going to step out now. That's my claim about utilising a member of the team and move over to you.
Thank you, Elle-Marie. Thank you very much for inviting me here today, everybody. So I'm joining you from the Northwest here up in sunny Wigan. So I work for Wrightington, Wigan and Lee NHS Foundation Trust. And I just want to tell you a little bit about our service up here in the north, which is an independent service. So Wrightington, Wigan and Lee, we have 3 sites. On our acute site, we have a 24-hour obstetric theatre, which is predominantly where we use our cell salvage. We also have emergency theatre and a normal orthopaedic theatre. And across on our elective site, we have at Wrightington a specialist orthopaedic hospital which performs high volumes of joint replacements and specialist orthopaedic surgery. So we also have a lot of cell salvage requirement over there. We are one of 9 acute service providers up here in Manchester. We report to our hospital transfusion committee and our divisional quality executive groups. We have a cell salvage lead and we have an independent practitioner service. We have 25 operators across the trust. We have increased establishments on each site and they predominantly work within the anaesthetic recovery role as ODPs and anaesthetic recovery nurses. We have an electronic database between sites where we record all of the cases that we undertake, and in the last 12 months we saw 600 cases across site receiving cell salvage blood back. Within our independent service, we provide the cell salvage service intraoperatively, but within that role we also take on a few more hats, mainly leadership of the operating theatre. We also have the availability to help with efficiency of theatre and touch time utilisation, so we help with the high turnover of cases, which helps obviously financially getting the cases through. And because we have an MDT approach, we also have some of our recovery nurses that are trained and recovery ODPs. So we have a dynamic team approach out of hours. So if we have any emergency cases during the evening, at nights or at weekends, the recovery practitioners come into theatre, they're part of the MDT and they're able to provide the cell salvage service and help us get the patient through so that we are again being efficient and effective with our time utilisation. So it's very much a dynamic team approach, and we are very much, we believe that we are all working within our scope of practice. In 2022, we had we did a national comparison of our obstetric unit, and we found that we'd had a huge spike in PPH within our unit. So we needed to do a bit of a deep dive to see what we were doing right and what potentially we could improve. We found that during a PPH, any kind of crisis in theatre, we found that the team were becoming very task focused. However, having that independent anaesthetic or recovery practitioner doing cell salvage, it enabled them to have a more helicopter vision approach to the crisis at hand. We were seeing better escalation and communication within the team, swab washing and cumulative measurement of blood loss, which means that we were able to escalate and deal with the situation a lot better. We also had a second person on hand for the rapid infuser and drug and the blood traceability, which we all know when you are working on your own in anaesthetics, you can be very task overloaded when in an emergency. So when you are dual rolling, you become a little bit tunnel visioned and you may be focusing on one task and there may be a late escalation. So we found that having that independent practitioner brings better, stronger teamwork, and really effective communication and leadership within the theatre. With having multitask chaos in an emergency, having that one function lowers the cognitive strain on that practitioner, and it causes a much calmer environment in a crisis. And it also maintains composure of the team, and it makes clear thinking and clear decision making in a much more calmer environment. We all know in emergencies that human factors do kick in and we start juggling too many tasks, and it creates a high stressful environment for the team. So we believe having our independent practitioner really improves accuracy and safety of our patients, and they are really truly an amazing team. We find that we were having late recognition and management of the coagulopathy of patients in obstetrics. So having that additional practitioner, we were able to now perform a TEG sooner within theatre. We also found that during cases we were having a lot of guesstimations of EBL. So we were having a real focus on measured blood loss and making sure we were escalating appropriately. We now, within the sterile field, do independent measurement of swabs just before we use the swab wash. That's because a medium blood swab can hold up to 200 mils. We were finding that we were waiting towards more of the end of the case to do that generic times the red blood cells by 3 so that we could give a estimated blood loss, but now we're able to really give an accurate measurement of blood loss and act on everything independently. We're also part of the Obstetric UK bleeding study to improve our services here on the Wigan site. And I also just want to mention our elective site for orthopaedic surgery. The team are very, very much focused on that touch time utilization and efficiency of getting our patients through surgery, and having that independent practitioner means that we're able to minimize that time between patients and get more patients through their operations, which is exceptional. So I just want to say kudos to them. And that's my debate over.
Thanks, Caroline. I massively acknowledge what you're saying, and I think that there is a huge role in emergencies and in high blood loss volume cases for an independent practitioner. So yeah, really, really get that. I think in routine cases and cases with minimal or moderate blood loss, obviously my viewpoint is that you can use a dual operator. I think training is key, and communication, the factors that you've said, are massively important.